Are you still looking for that perfect pillow to fix your neck pain? Well, you can stop looking because it isn't a pillow that's going to do that for you. In fact, it isn't because of our pillow or how we sleep that's caused all of our neck pain and tension headaches. It's been what we've been doing to ourselves our entire lives. And I'm going to share with you a couple of techniques to get you started on your healing journey later in this video. Hey everybody, Brian Meadows here from CorrectiveMechanics.com. I want to talk to you about neck pain and how a pillow is not going to solve your problem. It's far more serious of an issue than you realize. In fact, I bet you've been through a cycle of purchasing pillows already and trying them out, and you might have even felt good the first night. But it probably wasn't very long before you had to start taking pain medication again to get over that neck pain that you wake up with in the morning. Yes, a pillow will help you sleep better. It might even be more comfortable, especially when you sleep a certain way, whether you're prone sleeper on your side or on your back. There are some pillows that are suggested for that type of sleeping that will make it more comfortable, but it'll never fix the issue that you have with your neck pain. That's because it doesn't address the issue. It's like taking aspirin or an ibuprofen to help with the pain of your neck. Sure, it works, but it comes back, doesn't it? It only lasts for so long. And we got to remember, all we're doing is addressing the symptom of pain. We're not addressing the cause of the pain. Take a look at yourself. Seriously, go look in the mirror. Do you look like someone who has good posture and is perfectly erect? Or do you look like someone that came out of a cave? All right, that may have been a little over the top and a little too much, but I'm not kidding. Do you have a good posture and standing erect? Or do you have a head that migrates forward and your neck is leaning forward? And maybe even some rounded shoulders. Does that look like you? Then probably you have what's called forward head posture or even upper cross syndrome, which is a little bit more serious. This condition just doesn't happen overnight and is caused over time, probably from any kind of career that you have, like probably billions of us or have ever had a career where we're constantly sitting down day in, day out. And I would even say when you go home after work, you're probably sitting down again, trying to relax, watch some TV, maybe even play some video games. And another thing that's common to our lifestyle these days is cell phones. And we're too busy looking down all the time, looking at our cell phone rather than putting the phone up here. It's just so much easier, right, to look down. Well, that puts your head down and in a forward position as well. So it's the time, over time, and the experience of having bad posture that is causing our body to have weak muscles, to have compensations.
The muscles that tend to become underactive in individuals with forward head posture include the deep neck flexors, cervical erector spinae, lower trapezius muscles, and the rhomboids. Underactivity in these muscles contribute to the inability to maintain an upright position of your cervical spine. Muscles that often become overactive in those with forward head posture include the upper trapezius, levator scapulae, the scalenes, the sternocleidomastoid, and the suboccipitals. Overactivity of these muscles facilitate forward head migration, as well as in some cases, rounding of your shoulders.
And then finally, if we don't address this, it could lead to spinal and muscular remodeling, which could lead to some permanence. And if that's happening and you have that bad posture, that's only going to create a domino effect with other parts of your body. It could start affecting the whole kinetic chain. And that creates the cumulative injury cycle. And I've done a video on that as well, on how to break that cumulative injury cycle with corrective exercise. The good news is there is something we can do in stopping this, alleviating it, and correcting it, and putting everything back to the way it used to be. And it doesn't require any medications, and it doesn't require any surgery. So what I'm offering you is something that you can do yourself at home. In fact, I'm going to show you a couple of techniques right now that will help you alleviate some pain. But if you want that permanent fix, we have a program on correctivemechanics.com that will guide you through a whole step process for your specific imbalances and dysfunctions. And for you specifically, it will help you know exactly what to do and the right procedure to fix those issues. But first, let me give you that few tips. Tips that I have for you are actually some real techniques that we use in our program, and that is called self-myofascial release and stretching. When performing myofascial release, we actually put pressure on the trigger point of the muscle that we're working. When you do that, you might have a little bit of localized discomfort or even a little bit of pain. That is actually normal. If you experience numbness or shooting pain and it emanates in different directions, then all we need to do is move off of that spot and find another pressure point that is localized. If you're feeling numbness and shooting pains because you're pressing on a nerve, that's not in the right spot. We want to be pressing on muscle instead. Now, working some specific muscles like the upper trapezius on the same side that you're working, you might get some what's called referral pain, which is along the jawline. It's a little discomfort, kind of like your jaw's a little sore. That's actually normal, and don't worry about that. Now, we have several tools that we use for myofascial techniques. One is called a therapy cane. Another one I like to use a lot is just a hard softball size ball. And I use this between my body and the wall, using the wall as a base. And the other apparatus that we use is a foam roller. I like this one because it has little nubs and it can put a little bit more focus pressure on my trigger point. So for the muscles that we're going to work, we could either use the therapy cane, a softball, or even the corner of a doorway, using the corner of that wall right on that trigger point and using pressure there. So the muscles that we're working are the upper trapezius muscle for this example. So using the softball, we place the softball anywhere along that upper trapezius muscle that we showed earlier, anywhere along that and between the wall. So just putting the ball against the wall and then putting your back against it. And if we're going to roll around and until you find that particular trigger point, again, not numbness, not shooting pain, but just a localized pain. And then you're going to stay there and hold it for 30 seconds. Why 30 seconds? 30 seconds is the scientific method minimum to tell the muscle and the Golgi tendon to release and relax, and it allows that muscle fibers to expand and relax. Using a therapy cane, we do the same thing, except we take the curved part, we put it on our back, and we look for that trigger point. And once we find that trigger point, moving the cane up and down the muscle, once we find it, we're going to push on the bottom end here, right here, away from us. And that translates into pressure coming around to that point on the other end, putting some pressure. So you can regulate how much you want to do. And you can even angle the cane in different directions that makes sure that you can get to that trigger point. So I'm going to show you here. So the trapezius muscle runs from the cervical spine and along the neck all the way down and over to the clavicle, or to the clavicle on the front, but also to your scapula on the back and along the top and on the inside. So kind of right around here. But you might feel a trigger point closer to the spine. That's fine. But you're going to grab that spot, find it, and then press forward on that bottom part of the cane. And you can even turn your neck away from the trigger point to give a little bit of stretch. And again, you're going to hold that for a minimum of 30 seconds. You can go a little longer, but I wouldn't go too long, because going a little long will just continue to put too much pressure on that muscle and your muscle might react. So once you finish counting to 30 or 40 seconds, then you move along that same side of the muscle looking for any other trigger points. Once you're done with that side, you go to the other side and repeat. Now, if you don't have any of these tools, or you find it difficult to use a door jamb or a doorway to do that same exercise, you could have another person help you out. They can use the palm of their hand. They can use their thumb to give a little bit more focused pressure, or even the elbow, which gives a little bit more weight and more focused pressure on that trigger point. It's all up to you and the level of comfort that you're willing to deal with. But just remember, the keys are finding the trigger localized point, not numbness, not shooting, and hold for a minimum of 30 seconds. The next technique to use after self-myofascial release is stretching. And since we were focused on the upper trapezius muscle in this example, I'll show you the stretch for that. It's very simple. We're just going to take our head and tilt it away from the side, one side. In this case, we were working the right side, so I'm going to tilt my head to the left. And you're going to keep your body up straight, but just bend your neck to the side. And if that is painful enough because you're feeling a tightness in there, that's a good stretch. That's all you need. If you need to go a little bit more, you could take your hand, press it up, put it on top of the side of the head, and just gently pull down. And I do mean gently, you don't need to tug. Hold this again for 30 seconds to 40 seconds. Same scientific principle. And don't forget to work on the other side. Hey, if you like this video, do me a favor, go down and hit the like button and even subscribe and hit that alert button so the next time I put a video out, you don't miss it. You can also go to correctivemechanics.com and take a look at some other of our blogs and videos and doing more similar tips and tricks on how to fix your posture and your imbalances. We also have a program called Body in Balance that you can join, and it's designed to go through step by step for you specifically, identifying your specific issues and imbalances and the specific techniques that need to be used to address those same issues and imbalances so that you can get back to a fully functioning and healthy body. Thanks a lot. Take care. Talk to you next time.